Dr. Afable leaned over to me and said, "Hey, Mike, can you shorten my introduction?" It's a very humble gesture from a humble guy, but as the CEO of this company, of Hoag Hospital, and this impressive healthcare network, we're not going to let you off that easy. They treat nearly 30,000 inpatients and 350,000 outpatients annually in their 2 acute care hospitals, their 7 health centers, and their 4 urgent care centers. He's been named one of the best regional hospitals by the U.S. News & World Report, endorsed by Orange County's most preferred hospital by the National Research Foundation for the past 15 years. And equally impressive, for the last 15 years, the Orange County residents have chosen Hoag as the county's best hospital in a local survey. So he was the Executive Vice President and Chief Medical Officer at Catholic Healthcare East, and was the founder and president and CEO of Preferred Physician Providers. He was a professor at Wake Forest and at Northwestern University. Let me just summarize to say it's easy to say improve quality and lower costs. It's hard to do. And it takes a visionary, it takes somebody that can connect the dots, and we're very fortunate to have a leader like Dr. Rick Afable in our community. Rick, thanks.
Great talking. Thank you, Mike. Regarding the introduction, I tried. Before I get started, by the way, welcome to everyone. I'm so glad that you're here this morning, so happy for the turnout. Obviously, healthcare is a very important and interesting and critical element of what we do here in Orange County, in our community, and this country. And that's reflected very much by all of your being here today. Before I get started, I did want to acknowledge 2 individuals who spent tireless hours putting this forum together. So please join me in thanking Greg Gissendanner and Kyle Westcoat for the tremendous job that they have done in putting together this conference. Thank you, guys. It was their idea from the beginning, and it's really come off so fantastically, and we'll keep doing it while there is interest and need, and I think that may be for a while. In 1993, then President Bill Clinton was asked the question, why is it that you're so focused on healthcare? Those of you who were around in those days and recall that what was affectionately called Hillary Care was all the rage at that time, which was the whole notion of healthcare reform to improve healthcare and improve the provision of healthcare services in our communities and in our country. And when he was asked what was wrong with healthcare, Bill Clinton said, we are not getting the results we are paying for, end quote. Recently, now past President Bill Clinton, just earlier this year as a matter of fact, was asked the very same question, actually quite innocently by, I think, a CNN reporter or someone as such. President Clinton, why are we paying so much attention to healthcare? What is it about healthcare? What's wrong with healthcare? And his answer was, we are not getting the results we are paying for. 10 years later, things haven't changed much as it relates to healthcare and healthcare delivery. The total spend on healthcare in January of 2014, when the Affordable Care Act, also known as Obamacare, is enacted fully. There are elements of it that are being enacted as we speak, and have been for the last 2 years, but most of the action will happen in January of 2014. We will, as a country, be spending almost $3 trillion on healthcare at that time. That will be approaching 20% of the gross domestic product of this country. And what we can say, just as Bill Clinton said in 1993, and as he said again earlier this year, we're not getting what we pay for. Said another way, the results are not consistent with the investment. And that's what healthcare reform is all about. A little disclaimer I must add to this conversation. For certain individuals, for people who have a particular need, a particular healthcare need, there is no finer healthcare in the world than the healthcare we provide here in the United States. Period. There's no discussion on that. when the king of whatever, or the queen or of whatever, or the prime minister of whatever needs something and needs something very specific, where do they go to get their health care? Well, they come to the United States. So for individuals who have certain needs, we have the finest health care. But for the country at large, and for the employer groups that Dr. Lansky, that David represents oh so well in the Pacific Business Group on Health, it's the value that's the issue. And for large segments of our population, we're just not getting what we're paying for. Interestingly, employers know this now. So you're all employers. This is our business community, our Orange County business community. Employers are getting this in a big, big way. And Dr. Lansky showed us some data from programs at Boeing, at Safeway, and other organizations. All very significant healthcare innovative activities. I'm sure that some of you were sitting back in your table and back in your chairs thinking, wait a minute, what is it about this that makes me uncomfortable? Why are employers, why are companies getting involved in healthcare? Why are they deciding where people need to go to get their care? Why are they incenting employees in a certain fashion to try to receive care in one place versus another? What about clinics in companies, in the spaces, in the facilities? Employers get it. You all get it. And you're getting it more and more. And you understand very clearly that you must take responsibility for the care of your employees. You must take responsibility and provide for a basis, the means by which they can get the care that they need, because they have a right to good care. As an employer, you want to participate in that, and not only that, but it's good business. It's good business to have healthy and productive employees, and no one knows that better than you do. So as I frame where we are today then, especially compared to last year when we were having discussions about this with just the recent implementation of the Affordable Care Act, with a lot of unknowns as it relates to the political climate and even the financial climate, still coming out of the recession, and we still are coming out today. The one thing that is very clear in our discussions today versus the discussion we had a year ago is that the die has been cast. Value must be created in this environment known as healthcare, in this business and this mission and ministry known as healthcare and healthcare delivery. Consistent value is not achieved. David presented all the data. If you need any more data, I'm sure he'd be glad and others would be glad to provide it. Consistent value is not achieved. The cost escalation is unsustainable. We know that as well. And access to care is not equitable. It's not even. Not everyone can get the world-class care that I described to you earlier, especially the most vulnerable people in our communities. Access is not equitable. And so if there are three elements that are really driving healthcare reform, it's those three: inconsistent value, cost escalation that is not sustainable, and access needs to be more equitable. So as I think about healthcare reform then, you might be thinking about the Affordable Care Act, you might want to call it Obamacare, you might be thinking about John Roberts, maybe it's the Supreme Court, you're thinking about Washington, Jerry Brown, Prop 32, all these things just come to your mind. The reality is that healthcare reform has been in action and on the move for many years. It was on the move in 1993, it's on the move in 2003, and as we approach 2013, it's on the move as well, but at a speed and a pace like never before. There are many that are at the lead of this. The employer community and the business community, I would say, is the group that is most at the lead of healthcare reform. Not Washington, not Sacramento, not even the healthcare providers. It's really the employers and individuals who are making what I'll call consumer demands, good demands, because they're demands that are necessary as we address the issues that are so prevalent for us today and so important to us today. I recently attended a meeting of health system CEOs. So these are the CEOs of the largest healthcare systems in the United States. If I gave some of the names, you would know who they were. Locally, in California, these were the University of California hospitals. This was Scripps and Sharp. This was Stanford. On the national scale, yes, Cleveland was there, and yes, Rochester, Minnesota, and Mayo was there, and yes, New York Press was there, and yes, Johns Hopkins was there. The best health systems in this country. What was unique about this meeting that I just attended, I just came back from this meeting last week, is the tone of discussion today among healthcare leaders is so very different. So very different. 5 years ago, it would have been all about how do we maintain our independence, autonomy, and keep our turf while the money keeps flowing. 2 years ago, one of the most important business principles that I've learned the hard way in many ways, captured in 2 words, was the primary mover in the meeting that I attended 2 years ago. And those 2 words that were driving that meeting were, uh-oh. All of the thoughts and the hopes of our autonomy, our independence, and our ability to stay away from anything other than what we wanted to do and how we wanted to maintain as healthcare providers has been lost. This last meeting that I just attended, a very different tone. And the tone was away from a defensive move and a defensive reaction to leadership. What a concept. The question that came up at this most recent meeting is, how is it that we're going to lead what is now an inevitable direction in healthcare, which is the creation of value and an improvement in the health of the people that we serve, the populations that we serve? How is it that we can improve the health of the people who are seeking care from us? Move away from the concepts of sickness. Move away from the concepts of financing sickness, also known as health insurance, and move towards a concept of health in our communities and health in the population. So what I would say to Dr. Lansky then, David, I want to make this comment to you. While the employer community is worried about consolidation among healthcare providers, and by the way, from past behaviors, you should. You should be worried. Because yes, maybe we would amass size, and maybe we would amass power, and maybe we would be able to drive behaviors such that we could maintain referrals into our hospitals, into our health systems, and choose the prices we want, as opposed to the prices you want to pay. What I would say from the standpoint of healthcare reform and the position of healthcare organizations, certainly my organization and other organizations that we'll be working with soon and in the future, our understanding is clear. We need to change who we are and how we function and what we do, and we will need to move to a leadership, a partnership, and a collaborative mode in order for us to achieve the goals that are most consistent with the 3 problems that I had mentioned previously, which is cost, the lack of consistent quality, a real test of value, and access. That movement is happening. That's the healthcare reform that's going on. And it's an exciting time because it is the greatest time of opportunity that I've seen in my 30 years of healthcare. As I think about some of the key concepts for the future then, I could have touched on many different things. So here, I just penned a few items that I could have spoken of. I could have talked about quality and safety, improving the quality of care and services. Dr. Lansky mentioned the data on knee replacements and mentioned the problem that his brother had and has been having with a quality item, which is unwanted infections and hospital-associated infections. We could be talking about healthcare benefits design. So talking about benefits and what it is that our model of insurance and our future models of insurance are going to be all about. I could have talked deeply about payment models. Dr. Lansky mentioned bundle payment, prospective payment, return to managed care. Information technology is a key item for all of us. When you think about the businesses that you're in or the industries that are moving forward in a very rapid fashion, that are leading to real value, the quality of products improving rapidly while the costs go down, What is moving that faster than anything is information technology, computerization, automation, the use of digital information, and the spread of information openly across all entities and all providers. Information technology is going to be key for healthcare. Transparency is something we could speak of. The openness and the ability to share information so that we would know here in Orange County which of the surgical sites that do a knee replacement produce the best outcomes. What are the measures? What are the metrics? How many knee replacements were done? Where's the best place? I would think that our community and the people in our community, your employees, and everyone here who is contemplating having a joint replacement, in this case particularly a knee, ought to be able to know where is it that they can get the most value. And the value is the outcomes divided by the cost. Outcomes go up, cost goes down, the value is increased. We don't have that data. There are some of us who are working on it, by the way, and we'll soon be reporting these data. However, transparency is a very important and open book at this point, and one that needs to be worked on. And then another area of great importance is accountability. How is it that we drive accountability for those who are providing the care and the services? Who is accountable? And how does that accountability affect then what we do today and what we can do and will be doing tomorrow as it relates to healthcare and healthcare delivery? What I'd like to do, though, is to take all of those elements. So I talked about quality, safety, benefits design, new payment models, IT, transparency, measurement, accountability. Okay, that's all well and good. Those are the things that we want to be working on every day. But I'd like to put that all together and bring it together into a concept that I think is extremely important for us to be thinking about going forward, which is collaboration and collaborative activities that we will do as healthcare providers. So I don't want to think about employers anymore as outside of the healthcare delivery system, because Dr. David Lansky doesn't think of his clients and his membership that way, and I don't think we as healthcare providers should be either. Employer community, healthcare provider community, health plans that are there to support, encourage, promote, and develop what it is we do, all around the core central piece of healthcare delivery, which is the person. And that person must be engaged as well, just as we heard earlier. So just a few moments then, in a few minutes, on collaboration and integration. I believe, and many people believe, many of us in healthcare believe, that in order to achieve value-added results, we're going to need to collaborate with others. Hoag Hospital and our partners in the future, St. Joseph Health, other organizations that we'll be partnering with, cannot provide for the healthcare needs of this community alone. We have to and must do that in collaboration with the other participants in healthcare and health system delivery. That includes employers, but it is also important, and health plans, but it also importantly includes the engagement with individuals, something we're not very good at. And unfortunately, something we as individuals are probably not very good at either. We don't have the information, we don't have the motivation, and we don't really have the abilities that we will need. We need the instruction that is necessary in order to get there. Non-traditional collaboration is something that you're going to all see in a very significant way going forward. And that then leads to the concept of integration. And integration means a whole lot as it relates to addressing the very issues of healthcare delivery such that we get the results that we want. But we know that there's one result that nobody wants as it relates to healthcare delivery or any of your businesses, and that's waste. And if there's one thing that integration through collaborative efforts can do more than anything else is to eliminate waste. And waste isn't necessarily because of some bad intent. In fact, in my view, waste or unnecessary care, unnecessary services, in many ways, we're a victim of that as providers of care as much as employers are in the paying of care, as well as patients are in the receiving of care. Because in many ways, we don't know the waste that exists because we don't have the information and the capabilities to be able to analyze and understand what waste might be. We know, for example, that in our emergency rooms, a place where we at Hoag are providing significant care every day, all day, every day, that a lot of what we do is because we don't have information. What if we had information on someone's complaint when they came to the emergency room? What if we knew what just happened a day before, a week before, or a year before? That would cause us to be able to take significant actions that we don't necessarily need to take today. So the integration of care, mostly through information management, through understanding and alignment around motivations for what we're trying to achieve, which is the creation of value. Let's be very clear on how we define that and understand that it is outcomes, the patient experience, and the lowering of costs, are elements of integration and collaboration that can occur and will occur. Dr. Lansky gave a few examples of where integration can really make a huge difference. Primary care medical homes, accountable care organizations, things that you've heard about, population health management activities. These are all efforts at integration which will improve outcomes, but at their core do something that you all understand all too well as businesses and that we need to understand better, which is the elimination and the removal of waste. So what does this mean for the Orange County business community then? Again, I touched on just one element, which is the collaboration piece. The first, I want to make you aware that there are going to be changes in the provider landscape here in Orange County. You're going to be seeing some organizations coming together, working together, and you're going to read in the Orange County Business Journal or OC Metro or the Orange County Register, and you're going to ask the question, what does that mean? What does that mean for me? What does that mean for us and our community? What does it mean for my company? As the providers begin to come together, what we'd like to do is to invite you as a community to be part of that. We don't want to build bigger hospital companies or bigger provider organizations. What we want to build is a collaborative. And so that's going to require you to be making some choices. One of the choices that you're going to need to be making is, who do I work with and who has my and my company's best interests in mind? And so this comes down to the trust factor, doesn't it? This comes down to understanding who it is has the commitment and the alignment of ideas, the values that we have as a company, and who has our best interests in mind, and that's who you should be looking at. A second item is new payment models will be coming forth, and what we want to do as a provider organization, as a healthcare organization, a company, is we want to be innovating in these areas. And we really want to do that as an experiment, if you will, with you and with the employer community in Orange County, because we can and should be leading in a very significant way. We will lead. The country is watching us, and we need to be doing that in a collaborative way with integration of care and services. The innovation will be significant, not so much because Edwards Life Sciences will make a great new valve, by the way, they will, and not because Massimo is going to create new diagnostic equipment, by the way, they will, and many of the other great organizations and the biotech companies in Orange County are going to be doing those sorts of things. But the innovation is going to be around providing care and sets of services and the processes of care, and we need partners to do that. And so those partnerships will be developing, and will be developing in a big way. I'm providing for you an invitation. I'm inviting the community of Orange, this Orange County community, to come together and to have a collaborative effort in creating better healthcare in our communities. We've made a commitment as an organization. Other organizations that we're working with have made that commitment, and I hope that you'll be able to make that commitment as well. What will you see as a result of this? Healthcare will be better in Orange County. Your employees will be healthier. Your costs will go down, and we'll be leading the nation. Thank you very much.
Thank you.